So, good evening. I'm going to talk about mental health and how the professionals or the experts in mental health can contribute to advocacy and to the establishment of evidence-based treatments. So, I'm going to share with you a PowerPoint. So, mental health is something with past, present, and future. I will show you some examples how our research group uh, had contributed to mental health and to advocacy in mental health. An example is the publication of books. Here's my book, which was published by Springer Nature in 23. It's about clinical psychology and cognitive behavior psychotherapy in various mental health disorders under the recovery perspective. So this is a book which can be uh, it is written for experts, but uh, family members who are confronted with mental health disorders or clients with mental health disorders can read also this book. And another example of advocacy in mental health is the book of our research group uh, uh, about treatment-resistant schizophrenia, which was published by Springer Nature in 24. And this is a very good example of a very intensive ambulant treatment in treatment-resistant schizophrenia. Another example is our book about treatment-resistant bipolar disorder, which focuses also on ambulant treatment. So treatment-resistant schizophrenia and treatment-resistant bipolar disorder are associated with high suicidal risk and frequent hospitalizations. So it was clear for us that we should publish a therapeutic manual for these subcategories. Another example of advocacy in mental health is the implementation of clinical trials. We have implemented a clinical trial between 22 and 24 about the effectiveness and efficacy of the combination of the integrated psychological therapy and metacognitive training, which is yet under review in a journal. This was this combination is a part of our manual about treatment-resistant schizophrenia. It is a very important part of recovery treatment-resistant CR. Nowadays, we go on with two more clinical trials between 25 and 27, the combination of pharmacotherapy and cognitive behavior psychotherapy under the recovery perspective, NCT 069936662, and the combination of pharmacotherapy with recovery treatment-resistant ZR and recovery treatment-resistant bipolar disorder. ZR NCT 7047651. So clinical trials is a very good example of advocacy because we have the opportunity to offer psychotherapy to patients and clients and families with patients with mental health disorders. And this psychotherapy is combined with research regarding the effectiveness and efficacy of therapies. The main goal of an evidence-based psychotherapy is the recovery as an outcome. That means the result of the tests are the main focus. These are objective results through an evidence-based psychometric evaluation. And we focus on psychopathology, quality of life, and functional outcome. And then the recovery as a process. That means this is a subjective evaluation of recovery. We focus on the point of view of the clients, on the point of view of families of the clients. We enhance the responsibility towards their own problems. They are active participants on their own problems and the protagonist of their own life, and this is a dynamic procedure. Another example of advocacy in mental health is a publication of the paper regarding the effectiveness of an online group cognitive behavioral psychotherapy in Hellenic Cystic Fibrosis Association in patients and caregivers by the Journal of Rational Emotive and Cognitive Behavioral Therapy of Springer Nature. This was published 1 week ago, and it is also a very good example of advocacy. This is the result of a volunteer action from me to the Hellenic Cystic Fibrosis Association, and we would like to evaluate the effectiveness for the first time in Greece of an online group cognitive behavioral psychotherapy for patients and caregivers. So this is also a very good example of advocacy. So research and clinical practice is a dynamic procedure, and we're very glad that we participate very active in this dynamic procedure. I have won an award, and it was something that I didn't expect, but they have announced that I have won the Best Researcher Award from Life Science Award. And this award is dedicated to my colleague, Polixeni Georgila, to my family, to all the patients I treated and I treat, and to all the professors, mainly in Germany, with who I cooperated all these years, and finally to the 2 universities in Germany in which I have studied, the University of Göttingen, in which I have finished my psychology studies, and the University of Koblenz-Landau, in which I have done a PhD study. So this award is also dedicated to my PhD mentor, my PhD supervisor, Professor Dr. Annette Schröder. So that means advocacy in mental health is a very dynamic procedure in which research and clinical practice is combined. And many people, even if you win an award, many people participate in this procedure. Professors, patients and clients, colleagues, family, and this is something very nice. So it is very important that we offer this combination to the people who suffer from mental health disorders. We need clinical praxis, but we also need research so that we know what is effective and what is not. So this is our research group. I want to thank my colleague, Dr. Polixen Georgila. She's a very important mentor for me, and we have worked very hard for these two books about treatment-resistant schizophrenia and treatment-resistant bipolar disorder during the last years. And we treat nowadays patients with these disorders, and it is a very nice journey all these years. So So this was the publication of books, the implementation of therapies, the implementation of research, clinical trials, and the combination of research and clinical praxis are very good examples of advocacy in mental health. We are committed to offer best possible treatments to vulnerable people. And this is more important today, nowadays, because we hear every day very negative news about a possible world war, about conflicts between many countries. So mental health experts are going have played a very important role, they play a very important role and are going to play a very important role regarding the social circumstances of our world. So we have to fight for more advocacy in mental health, for more freedom and sustainability. So we are active protagonists of the life of our clients and their families, and we're very proud of this procedure. So I hope that you have good examples of advocacy, and I think we have to go on with all this dynamic procedure in mental health, and especially in Greece. So I wish you all the best and a nice evening.